Bacon for breakfast, a ham sandwich for lunch, and hot dogs for dinner. Could be a recipe for heart failure. I'm Rochelle Grossman with your latest health news. People who eat the most processed red meat are more likely to have the highest heart failure rates, according to a new study. The study looked at how red meat consumption affects heart failure and death. The authors noted that eating unprocessed red meat did not carry the same risk, possibly because the meats don't contain the sodium and other additives found in sausages and cold cuts. Experts suggest you reduce the amount of processed red meat in your diet.
Women who have pregnancy complications may feel relieved when a healthy delivery is in the past, but if you had high blood pressure during pregnancy, you may want to let your post-pregnancy physician know. I'm Jennifer Dodd, and this is a Daily RX Minute. A recent study found that women who had pregnancy complications related to high blood pressure were more likely to have risk factors related to heart disease and diabetes a few years after giving birth than women who didn't have high blood pressure during pregnancy. Tell your primary care doctor if you had preeclampsia. For Daily RX TV, I'm Jennifer Dodd.
It is a common belief that memory problems are the first sign of Alzheimer's disease, but it is not always the first sign for everyone. There are several other clues that Alzheimer's may be developing. I'm Mindy Cook, and this is a health feature. Alzheimer's disease is a form of dementia that affects the brain, causing a decline in thinking, remembering, reasoning, and behavioral abilities to such a degree that it interferes with daily life and activities. Those who are suffering from the disease may find it difficult to recall names, dates, or events that have taken place. Losing items is a common occurrence, and difficulty with familiar tasks such as handling money, making decisions, and problem solving are also characteristic of early Alzheimer's. Social elements, like the ability to hold a conversation, a change in the person's general demeanor and mood, and withdrawal from social situations can also be indicative of Alzheimer's disease. Presently, there is no cure for Alzheimer's disease. Most people who are diagnosed are 65 or older. Those who are diagnosed at the age of 80 or older may die within 3 or 4 years of diagnosis, but those diagnosed at a younger age may live 10 years or more. Speak with your doctor if you have any signs of early Alzheimer's disease. Your doctor will help distinguish symptoms that occur as part of aging from those that may be related to Alzheimer's. While there is no cure yet, there are some treatments that may help maintain memory, thinking, speaking, and some behavioral problems for a period of time.
A stroke is an event that occurs when blood flow to the brain is stopped or interrupted. Decreases in blood flow to the brain can cause symptoms including sudden numbness, confusion, difficulty with seeing and speaking, and abrupt severe headaches. There are two general types of stroke, ischemic and hemorrhagic. Ischemic strokes are caused by blood clots that may block blood vessels in the brain. Hemorrhagic strokes are caused by broken blood vessels in the brain that result in bleeding and loss of blood supply. Patients at risk for strokes include those that have high blood pressure, high cholesterol, or diabetes. Alcohol abuse, illegal drug use, and cigarette smoking have also been linked to significant increases in stroke risk. Strokes are serious medical emergencies and can often be difficult to treat. Some strokes require blood thinners and other medications to prevent future blood clots. Others may require surgery or significant prolonged care. Post-stroke rehab is often needed to help patients overcome disabilities that result from stroke damage. The best way to deal with strokes is to prevent them from recurring at all. Eat a healthy, balanced diet, monitor your cholesterol carefully, and get plenty of appropriate exercise.
As the popularity of youth ice hockey has grown in recent years, the injuries associated with it have grown as well. I'm Erin White with your latest health news. The American Academy of Pediatrics wrote that one of the most important ways to reduce injury risk was to expand programs to prevent body checking in the sport. Body checking is deliberately obstructing an opponent by putting one's body in their way. Dr. Michael Ishitani, a pediatric surgeon at the Mayo Clinic Children's Center, says due to the fast, hard-hitting nature of the game, people often ask what kinds of injuries might happen to my children.
The most common type of injuries were fractures, which may require splinting, casting, or even an operation to treat. The next most common type of injury was traumatic brain injuries, or more commonly known as concussions.
Speak with your child's coach about safety rules in their sport.
With more than 1 million new skin cancer cases in the U.S. every year, we all know we should wear sunscreen when spending time outdoors. But which sunscreen is best? I'm Rochelle Grossman, and this is a health feature. Thanks to tighter FDA regulations, we now have easier to understand labels that require makers to back up any protection claims. For example, sunscreens with an SPF of 15 or lower must carry a warning that reads, "Skin cancer, skin aging alert. This product has been shown only to help prevent sunburn." And products have to be realistic in their claims. Sunscreen can no longer claim to be waterproof or sweat-proof, and they can't claim to provide instant protection or protection that lasts longer than 2 hours without reapplying. You must reapply, and the new labels specifically tell you how often. And what about the letters UVA and UVB? Do they confuse you? Well, here's a quick lesson. Sunlight that reaches us is made up of both ultraviolet A and ultraviolet B rays. UVB rays result in sunburn, and all sunscreens offer protection from them. However, UVA rays account for 95% of the radiation we're exposed to. These rays sink deep into the skin and cause tanning, which causes aging, wrinkles, and cancer. If your sunscreen claims to be broad spectrum, it must block out both. Experts agree there is no safe amount of tanning, so they advise you to cover up, avoid the midday sun, and don't let cloud cover fool you. And those tanning booths, well, you might want to pass. According to the Skin Cancer Foundation, UVA radiation inside a tanning booth can be 12 times greater than that of the sun.
By translating health information into a consistent, easy-to-understand language, the DailyRx News Network enables you to take control of your health. Sign up for the DailyRx newsletter to receive the latest health news and videos right to your inbox every morning. For trusted, research-based health news, join us at DailyRx.com. Your health starts here.
Hypertension, or otherwise known as high blood pressure, is a condition identified by blood pressure that rises and stays higher than what is normal. High blood pressure often has no immediate noticeable signs or symptoms, but very high blood pressure can cause headaches, vision problems, and even damage certain organs. Hypertension that lasts for a long time can cause kidney damage, heart damage, and increase the risk of a stroke. Obese patients, older patients, smokers, diabetics, and patients with poor diets or a family history of high blood pressure are at a high risk of having high blood pressure. Alcohol abuse and illegal drug use can also cause blood pressure to rise. High blood pressure can be treated through healthy lifestyle changes such as diet and exercise, but in many cases, medications can help safely and effectively adjust blood pressure back to normal levels. ACE inhibitors such as lisinopril and diuretics such as hydrochlorothiazide are commonly used to treat high blood pressure. A wide variety of blood pressure medications are useful in different situations to treat hypertension when other medications fail. Preventing and managing hypertension is important to living a healthy life. Maintain an active lifestyle with plenty of exercise and avoid excessive salt intake in your diet. If you have a family history of hypertension or other major risk factors, take the time to monitor your blood pressure periodically.
Many cancers are not detected until it's too late, but there are some early signs of cancer that women might overlook. Knowing the symptoms to look for can help a doctor diagnose cancer early, which can boost the odds of successful treatment. I'm Erin White, and this is a health feature. The early signs of cancer in women can often be attributed to more common illnesses, but any unusual symptom that lasts for more than 2 weeks should be reported to a doctor, who can diagnose and treat the problem. Unusual bleeding, even if it goes away quickly, should be seen by a doctor, especially if you're older. It could signal leukemia, colorectal cancer, uterine cancer, or cervical cancer. Swollen lymph nodes or lumps around the neck, underarm, or groin should be examined by a doctor, as these are often signs that the body is fighting an infection. This could point to leukemia or breast cancer. Pelvic or abdominal pain, bloating, and feeling full when the discomfort isn't part of your monthly menstruation cycle or lasts for more than a few days may be a sign of ovarian cancer. Shortness of breath, wheezing, a bad cough or chest pain, difficulty swallowing, or a long-lasting feeling that you need to clear your throat could be signs of lung cancer, lung tumors, leukemia, esophageal, or throat cancer. Gut troubles such as a sudden drop in weight with no changes to diet or exercise, chronic upset stomach, cramps, or stomach ache may be signs of colon, pancreatic, or liver cancers. Skin changes or dark streaks or dots in fingernails and toenails, as well as nail cracks, could be symptoms of skin cancer. Additionally, fevers that last for long periods or reoccur may be leukemia. Listen to your body and know when to alert a doctor about any unusual symptoms.
Parents want to keep their children safe and healthy. So Dr. Ari Brown reminds her patients that vaccines are important, safe, and effective.
The truth is that vaccines are very safe and vaccines do their job. And the diseases that they are protecting against are quite real.
That's why doctors of the Texas Medical Association started the Be Wise Immunize program. They've given more than 100,000 free or low-cost shots to Texas children.
Vaccines have been one of the most important ways that we've been able to prevent serious illness and death in children.
Texas Medical Association, improving the health of all Texans.
COPD, otherwise known as chronic obstructive pulmonary disease, is a condition where the airways to the lungs are blocked from performing as well as they should. COPD may only cause mild symptoms at first. COPD symptoms include a cough that produces a lot of mucus, shortness of breath, especially with physical activity, wheezing, and chest tightness. Without proper management, COPD symptoms can become more severe and can even become life-threatening. A large portion of patients with COPD are active or former smokers. Long-term exposure to other lung irritants, such as air pollution, chemical fumes, or dust, may also cause or worsen COPD. There is no cure, but many treatments may help relieve symptoms. Bronchodilators, inhaled and oral steroids, and tiotropium are safe and effective medications often used. Oxygen therapy, surgery, or even lung transplants are sometimes necessary for certain patients. Patients with COPD or those trying to prevent COPD should avoid smoking or working in settings with poor air quality. A healthy diet, proper exercise, and other healthy lifestyle choices can also help prevent or manage COPD in many patients.